Okay, parents, your kids are going to turn out just fine.
This episode of the podcast is brought to you by FOCO. That's FOCO, F-O-C-O. If you are a parent of a child or teen with ADHD, you know how challenging it can be to keep them focused and engaged. FOCO is the all-natural solution for ADHD, whether it's for school, homework, or just everyday activities. FOCO helps your child or teen stay calm and attentive. Before trying prescription drugs like Adderall that can come with harsh side effects, I recommend you try FOCO. Visit ThinkFOCO, that's ThinkFoco, thinkfoco.com for more information. Welcome to the Your Kids Will Be Fine podcast. This is Dr. Michael Malofsky, board-certified pediatrician, father of 7, grandfather of 3. On our podcast, as always, we help parents sort through the glut of information and try to get to the real core of what's really important, and hopefully help parents decrease their anxiety about parenting choices and let everyone know that your kids are going to be fine. Today on the podcast, we're going to again be exploring some topics in integrative and functional pediatrics, specifically as it pertains to ADHD and the use of some supplements, nutritional supplements that are much more in the integrative and functional approach to ADHD as either a precursor or a complement to traditional prescription stimulant medication. So why is this a big deal and why are we talking about it? I think everybody's aware that there's a general increase in a recognition of the diagnosis of ADHD. I think likely the misunderstanding is that we're seeing an increase in incidence because of issues with our culture, technology, phone use. But that probably is not the case as much as that we are recognizing way more of the broader, nuanced ways that ADHD can present. ADHD is, as we all know, a diagnosis primarily of executive functioning disorder, where kids have trouble with self-inhibition, with working memory, with juggling multiple things, with intentionality, with initiating work, organization, attention and focus, all of those things. But we're also recognizing ADHD encompasses significant emotional regulation issues too. So it's both an emotional diagnosis and an executive functioning diagnosis. It often looks different in how it presents with boys and girls. And so our more sophisticated diagnostic recognition, a greater focus on more precise ways of identifying it and diagnosing it, certainly have increased the numbers of kids who end up now being diagnosed with ADHD. There's no question that there is still a large amount of ADHD symptoms that are mislabeled. Symptoms that are labeled as ADD or ADHD type symptoms in the school setting are not always due to ADHD. They can be caused by many non-ADD things, as an undiagnosed learning disability, such as dyslexia. Kids who are actually not sleeping well and have significant sleep dysfunction like undiagnosed snoring or obstructive sleep apnea. Kids who are suffering from a significant mood problem, specifically anxiety. And none of those things are treatable with ADD medication, and they aren't, but to a teacher or to school staff, they will look identical to kids with actual ADHD, which means that there needs to be a precise, stepwise, and measured, judicious way of assessing and diagnosing ADHD. So that aside, let's talk about what the evidence shows and what's out there in the complementary, functional, and integrative approach to ADHD that is not only about prescription stimulant medication. In our community, I practice in Colorado. We run a mental health clinic within our primary care practice. We take care of a lot of kids with anxiety, depression, mood, autism, and of course, ADD and ADHD. And so many of our families, especially families who are at the beginning of this process and whose kids are newly diagnosed, want a bigger discussion around what other things can I do for my child that are safe, potentially effective, and might be something to try prior to or in conjunction with prescription medication. Why the concern about or fear around prescription medication? Well, stimulants are powerful medicines. They work, and for the right child, they can be life-changing. There's no question. However, they come with baggage, side effects, irritability, mood changes, insomnia, appetite and gastrointestinal side effects, which for some kids can be so disruptive they don't want to take the medicine, and irritability, mood changes, volatility, as well as the potential for abuse. So, all in general, when properly dosed and properly used, those things are relatively rare. However, they are present. They do show up, and I certainly understand in when it's our own children who we are trying to help, why we would want a discussion about what are the other alternatives that can be healthy and safe as an alternative to these very powerful medications. So let's start at the top with the most evidence and move down to what is emerging in this space. So by far, the most evidence-based complementary and integrative approach centers around, first off, clean diet, good sleep hygiene, and exercise. All of those things improve all measures of ADHD symptoms. Kids who have ADD definitely benefit from regular intense exercise compared to kids with ADHD who don't exercise regularly. Kids who sleep better and have good sleep hygiene with high quality sleep definitely have improvement in symptom scores compared to the kids that struggle with that. So that's baseline. Second, it seems to be that omega-3 fish oil, especially the EPA part of fish oil, combined with a broad-based micronutrient supplement, basically a high-quality multivitamin, seems to correlate with the most consistent improvement in ADHD symptom scores when compared to not using those things. There's a broad amount of literature. There's a tremendous physician in this space who writes about this, Dr. Newmark, who's part of the Stanford University Integrative Pediatric Department, who writes a book, ADHD Without Drugs. And that is consistently the interventions that he recommends across the board for everybody. So that's by far the most established. So now we're going to move down to ones that are in common use that may not have the same body of evidence, but clearly have benefit for the right kids. So second is melatonin. Where does melatonin help? In general, in kids who are otherwise, shall we say, neurotypical kids who have ADHD, I'm excluding kids with other diagnoses, short-term use of melatonin, when I say short-term, I mean a few weeks to a month or two, of properly dosed and properly used melatonin to reestablish a healthy sleep cycle can be highly beneficial. I don't endorse long-term unmeasured use of melatonin with no endpoint in neurotypical and healthy children. It doesn't seem to offer a lot of benefit and might have some long-term risks that are poorly defined because melatonin is not regulated. But in general, it can be a really positive, short-term, if judiciously used and discussed, way of really improving ADHD symptoms by getting a regulated sleep schedule on track. So after melatonin, let's talk about magnesium, especially magnesium magnesium salts that are tend to be more easily accessible to the central nervous system. Magnesium has been rarely tested as monotherapy, meaning by itself, but there's lots of evidence to suggest that it has a benefit on sleep regulation, on mood and anxiety, on cognitive balance. So, and also very little downside. So when I am recommending a functional integrative approach to our patients with ADHD, I generally add magnesium as part of that too. Third are the amino acid supplements, L-theanine and L-tyrosine. There is an increased body of evidence around these, also in conjunction with caffeine, which we'll throw into this discussion as another supplement benefit, that it has real potential in this space. It needs to be studied more. There seems to be very little downside, but the mechanisms make sense. L-theanine and L-tyrosine are precursors to a lot of the neurotransmitters that work in the ADHD pathway, specifically dopamine and norepinephrine. L-theanine and L-theanine, especially in conjunction with caffeine specifically, seems to have a positive effect. There have been small studies using even functional MRI machines in kids that show it enhances those pathways of attention, focus, and task completion. Once again, side effects are minimal. There is none of those dangers that we associate with prescription stimulant medicine. And like a lot of things, when used in conjunction with many of these other strategies, I think have a potential to offer real benefit with a very high safety profile. So I am more and more adding L-theanine and L-tyrosine in conjunction with a small amount of caffeine. When I say small amount of caffeine, the amount present in about a cup of green tea, so maybe 40 to 60 milligrams. And then next on the list is a medicine, a plant-based nutraceutical that was really first studied in dementia, especially Alzheimer's, called Huperzine-A. Huperzine-A is a plant-based, naturally occurring anticholinesterase, which means it gently increases the level of acetylcholine, which is an inhibitory neurotransmitter in the brain. And that's one of the problems in kids with ADHD is self-inhibition. There have been real measurable clinical improvements when used in patients with Alzheimer's and dementia, but there is increasing suggestion that this can be an excellent adjunctive benefit to kids with ADHD. And once again, safety profile extremely high, side effects extremely low. So I am also much more inclined when having a detailed discussion with families about what their options are in this space to be including that with all of the other complementary, integrative, and functional parts of that discussion as an add-on. So I think the problem in the literature and the research is that so many of these are tested as monotherapy when we know that many of these things likely have a synergistic and complementary effect on one another when used together, especially with very, very high safety profile, very low side effect potential. And the fact that these are naturally occurring nutraceuticals and plant-based substances that are widely available and generally considered safe. So to summarize, when I am having this discussion with our ADHD patients about what they can do, this discussion can be used in two ways. Often with younger kids, families who say, hey, we really want to try everything else to see what the benefits are before we commit to stimulant medications. So in those families, we start with the discussion around healthy diet, healthy sleep, and plenty of exercise. And then we will talk about the benefits. We will add omega-3 fish oil, especially 700 to 1,000 milligrams of the EPA component combined with a broad-based multivitamin magnesium, and then a product that usually contains a combination of L-theanine, L-tyrosine, low-dose caffeine. Once again, that's really for kids 13 and above. In kids under 13, tend to stay away from the caffeine component. And maybe some melatonin, depending on the structure and the sleep pattern that they have and whether they need help with that. And the Huperzine-A. In older kids also, we'll throw in the caffeine. There are now also families who said, look, we've had some success with our stimulant medicine, but my child doesn't like the way it makes him or her feel. We will throw on that approach in addition to their stimulant medication and be able, in many cases, to decrease the doses of stimulant medication that they're on and maintain the positive benefits that they're experiencing with less side effects. And third, we have plenty of kids who we treat their ADHD in conjunction with their other neurocognitive issues, specifically kids who are on the autistic spectrum, many of whom also have ADHD symptoms. And those children specifically have a very poor response to stimulants, really don't tolerate them, in which case they seem to get a lot of benefit from this integrative and complementary approach with improvement in their ADHD symptoms and a lot less and not having to use medicines as much that cause them significant side effects. The stimulants have much higher side effect profile in kids on the spectrum. So these are all widely available. There is a family in my practice introduced me to an amazing product that I've been suggesting more and more because I've been deploying it in my mental health clinic, which is commercially available product called FOCO. You can find it at thinkfoco.com, also available, I think, on Amazon, which is a very convenient and handy combination of a lot of the things we talked about, specifically the L-theanine, the L-tyrosine, the low-dose caffeine for teenagers. They have a kid's gummy where it is without the caffeine, the Huperzine-A. And I've been really, really pleased with how I've worked this into my practice, and my patients and families who feel heard and feel validated in wanting to have a more functional integrative approach when they're treating their kids' attention deficit hyperactivity disorder. So remember to find us on all platforms where you get podcasts, Apple and Spotify, and our website, yourkidswillbefine.com, where you can download every episode, leave show comments and suggestions for future episodes. And we are looking forward to seeing you next time.